Eradicating guinea worm, the end of an era. Guinea worm dates back to 15th century BC. Guinea worm is contracted by drinking stagnant water from wells or ponds. Once ingested, the larvae migrate through the small intestine and the abdominal cavity. The larvae mate and grow and average 2 to 3 feet in length. A painful blister appears on the surface of the skin about 1 year later. Multiple worms can emerge from one blister. The cycle of contamination continues when individuals seek cool water to relieve the burning sensations. The water is then contaminated to more larvae. Guinea worm is one of the most preventable of parasitic diseases. An area that has been high risk for guinea worm is Asia and sub-Saharan Africa, and has gone from 3.5 million infected to less than 11,000 cases. But how did this happen? It happened with the help of various global coalitions staging an intervention to stop guinea worm and the spread of. There are no medications or vaccines to help prevent it. Interventions were basic improvements. Provisions focused on safe water through improvements which included deep well digging, applying larvicide, teaching how to filter water through cloth filters, and overall basic health education, because knowledge is power and vital to improving the quality of life. Between 1986 and 1998, the program cost an estimated $87 million, roughly $5 to $8 per case of guinea worm. This program was extremely cost-effective and cost-beneficial. Guinea worm can be extremely debilitating to a community, and there were challenges in devising a plan that would interrupt and stop transmission of the disease. Challenges included lack of data. There needed to be careful case identification, the need for political support, overcoming the program's slow start, financing, coordination, and challenges of helping a poor community. The focus of the program was securing safe water. The wells and basic cloth filters improved the quality of water tenfold and eliminated cross-contamination. Health education also showed the members of the communities they had control over their health and were capable of making positive changes. But not all the areas welcome interventions. Areas like Sudan have been plagued by years of civil wars, making it hard to implement provisions. Some progress has been made. In 1995, a ceasefire to guinea worm was implemented. During this time, filters were distributed and even vaccinations for children, vitamin A supplements, and rehydration therapies were distributed. The civil wars and conflict still remain, and until the conflicts stop, only then will guinea worm cease. Only when we are free can we choose to do what is best for our people and the health and lives of all that are at stake. The keys to successful intervention include coordination, pulling together people and resources, the power of data, advocacy, and political involvement. Interventions do take time, and guinea worm may never be eradicated, at least not today. But efforts can be made to break the cycle of transmission and ensure health and relatively low exposure to people at risk. You can learn more about guinea worm and other preventable parasitic threats and ways to get involved by visiting any number of the sites to organizations that were listed in this film.